Hey everyone, Strength Coach Tina here with a video on a self-assessment of hip mobility starting with a straight leg raise. You're going to set up on the ground on a mat just outside of a door jamb in an entryway between rooms of your home. So you have a vertical reference guide, okay? Ideally you'd have eyes along this line of sight, either using your video, your phone video, or a friendly set of eyes, but failing that, you can just eyeball it yourself. You're also going to need a strap. I have my kid's old karate strap. You might have a yoga strap or a nylon strap from the garage or a really long belt. Set that aside nearby. Sitting nice and tall, you want the upper kneecap to line up with the outer door jamb so that when you lie down, the mid kneecap is going to be drawn along in line with the actual entryway to the door. Your arms are at your side, your legs are totally straight. Your feet are together and your toes are up, meaning they point to the ceiling. And then slowly and under control, you're going to take a deep breath in. And as you exhale, you're going to raise that leg as high as you can before one of three things happens. Either the moving leg starts to bend at the knee, okay, and you have to be true to a straight knee here. There's no sense giving yourself a false score. You're only cheating yourself. Okay. Or as you raise that leg, one of two things happens to the lower leg. It lifts away from the ground or the toes turn away from the ceiling. They turn outward. Okay. So with that in mind, we're going to score ourselves. Okay. We're going to do this actively, meaning we use the muscles of the legs to actually perform the movement. So breathe in, exhale. My heel clears the doorway entry here. You see that, right? And that means I get a 2 out of 2. And now I'm going to do it on the other side. Exhale. No way. If I try and go further, I'm going to lift that lower leg. I feel a ton of tension through the back of that left leg. I don't quite clear the doorway with that heel. Do you see that? I get a 1 out of 2 there. So what now? If you have a 2 out of 2 both sides, A+. No need to go further. If you have a 1 on one side or both sides, here's what you're going to do next. You're going to grab your strap, put it underneath that right foot, set up again with your knees aligned so that we lie back. And now you're going to just lift the leg, okay, using the strength of your arms to help yourself. But you still have to obey all the rules. The legs have to stay straight. The lower leg has to stay straight. Toes have to face the ceiling. Okay, the score is a 2. That's not interesting. What I'm looking for is to see whether or not the score changes from a 1 to a 2. So if you had a 1, did it go to a 2 now? Let's see. I'm going to see this side. No, it definitely didn't. It's still a 1. Okay, what do I do with this information? If you had 1s and they stay 1s, then the tension is in the back of your legs. You need to work on stretching out those hamstrings. I can follow up with other videos, and you would look for videos to stretch the posterior chain, okay? If you went from a 1 to a 2 between the active and the passive, meaning the assisted version, your score improved, then it's one of two things. You either have a lot of tension in the hip flexors, or you have poor anterior core control because your core allows you to control the leg movements this way. And you're going to be able to parse that out if you follow along in the next part of the assessment, the next video, part 2 self-assessment, okay? Hip flexor tension. Let's imagine you had the thing that limited you was the toes rotating out. And usually those folks will also have an improvement in their score when they do a passive assist, like a lift. Again, it's very likely part of your hip flexor complex, and you're going to want to look at stretching and rolling this muscle that I call the anterior pocket muscle. So if you were to put your hands in the front pocket of your jeans, you would feel a muscle there. It's probably overactive. And it's overactive for a number of reasons, which we won't get into in this video, but suffice it to say, you're going to want to look at ways to stretch and roll your hip flexors. And I'm going to say probably strengthen your glutes as well. So that's direction. From here, you want to look at whether you need to do part 2 of the self-assessment or whether you need to direct some attention, as I do, to dealing with that posterior chain tension in the backs of my legs.